we're in a bit of a holding pattern right now, and I think the public sees it as well. In fact, the public's probably in a little bit of a holding pattern right now. And I just want to say, like, community compliance still remains high within the city, and our active cases actually are directly relative to the community compliance. And so if you take a look across the entire province, and so we have maintained fairly low rates and fairly low active rates all throughout the course of this, and we're still low, and we still foresee us being low. However, that being said, this isn't over, and I've said this time and time again, it's not going to be over for quite some time, and so rule fatigue is definitely setting in, and so we all need to get out of that rule fatigue, because this will stay with us. This virus is going to stay with us for quite some time. And with that, the city's been embarking on, I guess during this holding pattern, is embarking on preparing for what actually is next. And I think we can all potentially foresee what may be next, and with schools returning back and ultimately the gatherings increasing with that, as we saw with Alberta relaunch with stage 2, we saw a bit of an increase in our active cases. I mean, we can all foresee that those active cases would probably increase with schools returning. And so the city's embarked on preparation measures for that. And so similar to what we did kind of pre-COVID, and when we saw this on the horizon, was we really took a deep dive into our business continuity planning and what we do with increased absenteeism. So we're right back into that process once again, is planning for what could be next. And I don't want to necessarily say second wave, but I think that's on, I guess, everybody's mind right now, and you can't get away from it. So yes, we absolutely are preparing for items like that and scenarios like that. But I just also wanted to leave it off, and one thing that I've always been saying is, just your basic controls, your hand washing and your physical distancing and things like that. But I wanted to say one item in particular related to all of these controls. And with all of the different facilities and businesses that are opening up, you typically see all of these different controls in place. Your plexiglass barriers, your hand sanitizing stations. These are all great things that businesses and Alberta Health has recommended and put in place. But there's one control out there that is by far the most effective. And that's everybody's mentality to this, and everybody's, and I just don't want to say us as the city, but everybody that's watching this and everybody that's here in this room, but everybody's mentality and approach to this. And one even in particular to that, and one decision that people can make is stay home if you're sick. That has been proven to be the number one and best control out there, is not going out if you're sick. We have seen, and the province has definitely seen, an uptick in active cases directly related to sick people going out and disregarding rules, and given the fact that it is the rule fatigue, but that is by far the best control out there, is stay home if you're sick. And I'm adamant on that one, and I know Alberta Health and Alberta Health Services is adamant on that one. That is by far the best control out there. And so I just wanted to leave it off by saying thank you once again, as I always do. I mean, like I said, community compliance is definitely high. And so just want to say, like I said, thank you. Keep it up. We're in this for the long haul. It's a marathon, it's not a sprint.
So as I said, this is the last of our regularly scheduled meetings, and I hope you've all had a good summer. Other than we had Hill Pool destroyed, things have gone fairly well. I've continued to talk about continuity of business here in Medicine, business as usual. You're watching what's going on with levels of government, proroguing Parliament and not getting much business done. Yet last night, City of Medicine had approved a $66 million new generator. If any of you have been watching the media, there are rolling brownouts, blackouts in California right now, affecting a shortage of about 4,000 megawatts. And that proves a point as to why we need to continue the business as usual here in Medicine Hat. I don't think it would be acceptable to be having power outages here in Medicine Hat when we're under a heat warning. So we've tried to continue doing that, and you can see it all over the city. frankly, with the grass getting cut and the potholes being repaired and everything else that's going on. And as well, we have approved, unanimously also, approval of the QP contract last night, which is, again, continuing the business of the City of Medicine Hat. And I don't know how to show more gratitude for the members of QP coming forward, ratifying that contract, and then having the City Council ratified as well last night. Everybody just kind of takes labor peace for granted until your garbage isn't picked up for 2 weeks, and then everybody wants to get the problem solved. And we have had labor peace here in Medicine Hat for so many decades, and it's good to see that it's still continuing during a pandemic. As well, you have up until this Friday to pay your property taxes on your credit card if you like, and after that it's just the regular payment process where they're due by the end of September. And good news, I think, the Medicine Hat Big program is now fully subscribed here in Medicine Hat. The first $500,000 tranche is out in the community. And the money multiplier effect of that will go on for months and even years, because we required local contractors and local businesses to use other local businesses, and so money is constantly respent inside the economy. And so council and administration will be putting another $500,000 into the EntreCorp program to help stimulate and help businesses recover from this pandemic. And we're very aware of the mask debate. We're not living in a bubble here in Medicine Hat. City Council is not being cavalier, which is what I've heard, and had a very good and long discussion about a mask bylaw last night with some expert advice from people like Merrick, and looking at what other municipalities are doing. And for now, we are holding off. I like to quote a very intelligent person who says, "What's the problem you're trying to fix?" And that would be Merrick. And right now, that's a tool that we could use when perhaps a problem becomes evident in Medicine Hat. But what's happened here in Medicine Hat is that residents are behaving for the most part, and we have some of the lowest numbers in the province. And so we are going to continue to take a wait-and-see approach as a council on the mask bylaw. If you do remember, 6 months ago, we were one of the only municipalities that didn't declare a state of emergency. And there was a ton of pressure on myself and the rest of council and even the administrative to declare a state of emergency. And we were considered risky or cavalier at that point as to not doing that. But a local state of emergency is exactly that, a local state of emergency, not a worldwide state of emergency. And why would we declare a local state of emergency? And given time, City Council and administration was proven correct that that was the right approach, because the rest of the municipalities recognized that they'd overreacted and didn't need to second fuel or kick people out of their houses or force people to stay into their houses when there was already an emergency, a health emergency, state of emergency declared. So I'm asking residents to please wear your masks if you feel you need to, if you have immunodeficiency, comorbidity, if your family members do, and please try to get along and respect those that aren't. I'm noticing that a lot more businesses, of course we all know about Walmart mandating, but I'm seeing a lot of other businesses with paper on the window saying, no entry without a mask, and that's fine. And I'm asking you as residents to please support the local businesses, whether they have a mask or no mask mandatory policy, local ones, and not try to make a statement by not going places where there are and shopping on Amazon or something like that, because you not obviously have to wear a mask to shop on Amazon. So we will take a wait-and-see approach, and of course, history will be our judge. So that's all, unless there's some questions.
I'm also wondering if I could get just your thoughts on kind of that first chunk of the business grants being used up, and I guess the willingness of the businesses being involved in that.
Well, I think that, you'd almost have to be crazy not to take the city up on their offer, to tell you the truth. If you've had incurred expenses, or tried to diversify, or that word pivot during this pandemic and get new revenue streams, why wouldn't you take, I think, probably the only municipality on a per capita basis offering you $15,000, to help you recover. It was slow at first, I think, because there was an overwhelming amount of programs coming from federal, provincial, and then of course you have a municipality offering programs as well. But I think once the word got out, we've been pushing it very, very hard. here on our social media, getting testimonials from various businesses that have taken us up on the offer. However, I think businesses talking to business going, you know what, the city gave me $15,000, no strings attached, basically. I don't have to pay it back. You should get in on that as well. And I think we saw an exponential increase in the last 3 weeks.
Are you expecting that usage to, I guess, continue at the same level over the coming weeks once that next round of money is?
So we have earmarked, there is up to $2 million. We are releasing it at $500,000 each. So we'll see, but I do think that definitely the next $500,000 will go very quickly.
So the excellent question. So the question was regarding looking at our business continuity plans or reviewing our business continuity plans. So what that relates to is the continuity of essential services within the city. And so with a potential second wave occurring, we take from what we learned over the past 3, 4, close to 6 months now, and we apply it to our existing business continuity plans so that we can assure that we still have fresh water, treated water that is, we can keep the power going in the event of a second wave. So we're reviewing our business continuity plans to ensure that we have adequate staffing, adequate service availability to provide those essential services to the public. Because when you start looking at different things like increased absenteeism, from one of two things, or two things I should say, is number one is obviously being required to isolate or quarantine because of some of our own staff that may potentially become infected with COVID-19. But also the second aspect of it is with the reopening of schools, is there's a potential for those childcare challenges. And we don't know what is going to happen with the schools. The schools have a very robust plan. I want to commend the school board for that. But we don't know what is going to occur. We in this room have never been through this before. And so with the reintroduction of school and bringing all of those students back across Alberta with a near normal operation, which is their scenario one within the province, is, in the event that there is an outbreak in a school or in a class, is what is going to happen? I mean, the school shuts down, or will the school shut down? Will the classes shut down? And ultimately, that is going to impact all of us. So it may not impact those parents that potentially have, children in the higher grades, but what about those lower grades? And so we're planning for all of those aspects, is not just increased cases throughout the city, but also how are we going to keep our operations running for the public should we have cases internally with our own staff, but also, as I had said, is just general increased absenteeism. So that includes many different aspects, as I guess cross shifts, working from home, all of those different aspects. So we're re-reviewing, basically applying the lessons learned over the past 6 months now into the revision to our business continuity plans to just make them that much more accurate and that much more effective.